Perfect. Thank you, Leonardo. And then Scott Sasser, who's the president of acute care services at Prisma, might show up as well. He's probably well known to several of your staff members. He's down in Columbia quite a bit. And he might jump on the phone here as well.
Okay, well that'll be great. I'll certainly I think I see, as I was switching over to get to my email, the chair on. Chair Livingston, how are you, sir?
Hello, fine. How are you doing today?
Doing fine. I was just having a brief conversation with Dr. Osmond, who informed me that it's possible that Mr. Sasser might also be on the call. Dr. Sasser might be on the call later as well. So we might have a few of our experts on the call assisting us. So
Excuse me. Sounds great.
all right, Dr. Osmond, I just sent that agenda to you.
All right. Very good. I'll take a look at that.
Mr. Brown.
Yes, ma'am. Yes,
Oh,
ma'am.
yeah. I have the agenda. Is there anything else I need?
No, ma'am. There's nothing else in particular that you need.
Okay, thank you.
Okay. Did you receive the draft document for
That was a part of the council agenda, a council package.
No, ma'am. But if you did get it, a part of that, you probably got that as well. So we did send it in advance of just the council. It was supposed to be sent to both the committee and the council.
Yeah, I got it in a separate packet. I think I'm trying to remember now.
I received it, but I have it as a part of the council agenda, I think.
Okay. Well, in general, since the committee has to generally weigh in for the council, the design was for the committee to have the information as well as members of the council. But as long as you have it, I guess that's key.
Okay, I want to hold folks up. I know we have other meetings today and it's 3 o'clock. So I'm going to go ahead and call the meeting to order. Ms. Roberts?
Yes, sir.
Can you do a roll call for me so I can see which council members are here?
Yes, sir. McBride,
Here.
Livingston,
Here.
Walker, Myers,
Here.
Newton,
Here.
Okay, and I think I saw Ms. Horacio, did I not?
Yes, I'm joining in. Thank you.
And other council members? If not,
Manning is here, but not on the committee.
yes, thank you. And I see several staff members who are here. Let me entertain a motion for the adoption of the agenda.
So moved.
It's been moved.
I'll second it.
Properly second. Ms. Roberts, can you quickly call the roll? First of all, are there any change deletions to the agenda? If not, Ms. Roberts, can you call the roll for the agenda council members on the committee?
McBride,
Yes.
Livingston,
Yes.
Walker, Myers,
Yes.
Newton,
Okay.
It passes.
Thank you. What that brings us to is our
Yes.
on the agenda. It was brought up in a previous meeting that we consider putting together a
Mr. Chair,
yes.
sorry to interrupt you. This is Dahlia Myers. Before we go on, I keep hearing after the fact Ms. Newton replying or someone replying. There's some feedback or some other person trying to get in. I just wanted to make you aware.
Well, thank you. Ms. Newton, okay, and we'll have someone to follow up on that. Thank you.
Hi, I'm calling in from my phone, and I was muting my line when I wasn't speaking, so I don't know what the problem is. But I'm hearing everyone else is delayed.
Yeah, it was
On my-
delayed.
Okay, thank you, Ms. Myers. I didn't pick that up. Thank you, Ms. Newton.
You're welcome. I thought it was weird. You're welcome, sir.
Our first item on the agenda is there was some conversation in the previous meeting about consideration of the coronavirus committee, like our resilience committee, like our Blue Ribbon Committee, that would include key community folks and so forth too. And what I wanted to do was to have a discussion about that, to see whether or not that's something that the committee think we need to move forward with. And if that is the case, we need to figure out a way to just look at what those specific goals and objectives are going to be for that committee. What do we think the membership's going to look like? And also, you know, about a selection process in terms of how you go about putting those members together. So we can't resolve that day, but we at least want to have a discussion about it and decide whether we want to move forward with it, and so we can go ahead and make it happen. Because it's something it's already behind schedule in terms of trying to get done. So I just need to get some feedback on that.
Mr. Chair?
Yes. Nick?
Yes, this is Shakise Newton. And as a person who has joined council after the formation of a Blue Ribbon Committee, it would be helpful to me if perhaps you explained how those work and what they've done in the past so that I can apply that to this situation. Thank you.
What they've done in the past, and the one that's most recent is still going on was the one for the 2015 flood. And that was a group of citizens and council members. These citizens were folks who were actually homes were flooded, who was engaged in it, professionals, different community groups who were able to bring things together and provide resources and things of that nature too. So something similar to the development of that Blue Ribbon Committee is what I heard, yes. And anyone else want to respond to any other council members who are familiar with that?
Mr. Chairman, this is Jim Manning.
Mr. Manning.
So a couple others that I'm aware of before I even got on council in 2009, there was, I believe it was a 36-member community group, council members that looked at the transportation needs, started with the bus system and ultimately ended up in the referendum. That was a 36-member group. Additionally, we for a while had a group made up of kind of environmentalists and home builders and developers that came up with 21 recommendations as a group that led to 20 ordinance and policy changes. We also at one time had a group made up of 2 county administrative people, 2 people from the chamber. I believe there were 2 people from the city and somewhere else, and that resulted in a total redoing of our business licensing department, and that was probably 10 years ago. So those are a couple examples in addition.
And
Thank
Mr.
you,
Chair,
Thanks, Mr. Manning. Ms. Myers?
just having served on the Blue Ribbon Commission, I do know that as well as citizens groups and members of council and administrative staff, that there were constituent organizations as well that were very helpful on the commission, like the United Way.
Correct. Ms. Newton, does that kind of give you a picture of somewhat of an answer to your question?
Yes, that is helpful. Thank you. And so this is a committee that serves in an advisory board for council.
Yes, they would make recommendations though, yes.
Sure. Well, thank you. That information is helpful. And based on the information that you've shared, it sounds to me like it would be a good thing for us to do. Certainly, we have this committee and we meet, but this is a pandemic that leaves no corner of our community untouched. So to the extent that we have formal feedback mechanisms so that those in the community can reach out to us, in addition to what our constituents who reach out to us on an individual basis, but if we can go to them for their expertise and their feedback as feet on the ground, I think that that would be very helpful.
Thank you. Then I think with that said, I think what we need to consider now is the process we want to quickly use to try to come up with some specific goals and objectives for that committee. And also talk about selection of members. In other words, what do we want that membership to look like in terms of involvement and specific expertise or whatever we might need, citizen participation and so forth. I think we need to answer that question. And then how do we go about identifying and selecting those members? So any suggestion about how we proceed in getting to those points?
Mr. Chair.
Ms. McBride?
Yes. Initially, I'm just supporting the suggestion for the committee, because initially we talked about having a committee, but due to time, we had to organize this committee that we have immediately. The other component was that I remember in our discussion, even with council, we need to make sure that there was council representation on the committee. And the other component was that this one would be different from, we needed to differentiate this type of committee an advisory one different from the transportation committee. So I just wanted to remind you of some of those discussions.
Thank you. Any other feedback?
So
Go ahead.
if we're looking at this point, you want to look at the objectives, the membership, or?
Yeah, or we can just come up with a quick process of a few folks working, come up with some of those. Not trying to necessarily do them here, but just start getting some ideas quickly of what we think, those things ought to be. So we have some guidance of where we're going.
Well, one part, and I'm trying to think of how we combine or how we collaborate with the existing partnerships that we have already established with Prisma and the University of South Carolina and other entities with expertise in the COVID-19 issue. So that's going to be important to have people with expertise on that committee. And I'm going to sort of throw this off. The other part was to use the existing committee that we have now and have resource persons to this committee in terms of advising us. I hate to put that little loop in it, but that was the other thought.
And that's why I have some of those things that you talk about listed by membership. I think what we can do there is, just set a specific date and just have members of this committee at least to start making some recommendation about possible participants and groups and so forth, so we can start out trying to decide what they need to look like. But I think we need.
Hi, sorry, this is Melissa Nolan. I'm a professor at the Arnold School of Public Health at the University of South Carolina. I'm an infectious disease epidemiologist, and I'm helping with our future planning group, so helping decide how we are going to be repopulating the campus. And I would certainly love to be that person for you. I know Dr. Eric Osman is also on this call from Prisma, and he's involved in very similar activities at the hospital. So we are here to help serve in any way that we can and support this effort. Thank you.
Thank you. And that's what I mean by trying to identify those, as someone mentioned about partnerships, trying to identify those partnerships that we want to consider in terms of membership and so forth.
Well, I think we already have Prisma and the University of South Carolina. I guess United Way. These are some of the people that we worked with before. I'm assuming DHEC.
And in terms of the size of that committee, do we have an idea what size we want to be? Because what I like for us to do is, as Mr. McBride doing right now and some others, is at some point to just simply share the different individuals and groups that we think want to consider for the committee, and go ahead on and try to start reaching out to those folks as soon as possible. You know, let's say, for example, we can have a deadline by no later than Friday with names and so forth. Then we can have a discussion about those names and agencies, and go ahead on and at least get started on looking at what we want the committee to look like. And in the meantime, we can start working quickly on some objectives and goals. And I know, Ms. Myers, you've been talking about some of those already, so hopefully we can just pull some stuff together and come up with very specific objectives and goals. We pull together.
I'd be happy to pass them along to the committee for consideration.
Thank you.
You're welcome. Mr. Chair,
Yes. Ms. Newton?
this is Shakise Newton.
Yeah.
And I think that at this point, my internet connection is now unstable, so I apologize for any random noises. We have talked initially about people on the committee from public health, and I 100% support that recommendation and think that they absolutely have to be there. I'd also like to suggest that we consider having some members from the nonprofit community who perhaps serve a broad swath of our community and see situations on the ground. I think we would also want to probably have some sort of business representation as well. If we are trying to talk about something that affects the whole community, I think it would be important to have representation from across the different categories of the community, as well as citizens who are experiencing this pandemic the way we all are experiencing this pandemic. So absolutely 100% to our health community advising us. Also would like to see business, nonprofits, and citizens. And in terms of your initial question for number, I don't have a suggestion on that, and would like to perhaps learn from the numbers that we've used on our other committees, because I'm sure there's a point where you have an optimal number of people and a point where it becomes pretty unwieldy. Thank you, Mr. Chair.
Thank you. Let me suggest that as it relates to our work with Ms. Myers and staff, we'll come up with just a general goal of what we want to accomplish. And then folks who have specific objectives they think we want to achieve, just submit those to myself or Ms. Myers, and we'll work those out and get them back to the group real quick. And then we'll start thinking about and also the same thing with membership. Just submit whatever, add on to who we think ought to be involved in the process. Ms. Myers and I pull that together. And then we'll start thinking about a process to ask those folks to engage and so forth.
Mr. Chair.
Mr. Chair.
Ms. McBride, you recognize?
Yes, I would also like to consider the format, and I will submit something regarding that.
McBride format.
Don't put me down that I'm handling.
Gotcha down. No pressure.
Wait a minute, I just spoke with somebody from the University of South Carolina who's used to doing a lot of this planning. I can't recall your name. Are you still on?
Melissa Nolan, yeah.
Yeah, okay. Melissa.
Right, well, we'll let you delegate then.
Is that okay?
Thanks a lot. Any other questions about that? But I said we want to try to move quickly on that.
Mr. Chairman.
Mr. Mann, you recognize.
Thank you, sir. So two things. One, I believe I heard you say for committee members to make recommendations. I think you'd be remiss not to include the whole council. Additionally, until I had some idea what the general goal or mission of the group is, I really would have no idea who to even consider to if I'm allowed, not being a member of the committee, to submit either a name, an organization, or even a general themed area. Thank you.
Okay, thank you, Ms. Manning, which is good point. One thing I plan to do is just simply try to get that done and send something out to full council, perhaps between now and the end of the week. So that way you have a good idea of what type of person may best serve, because you have a better idea what the goals and objectives are. So we plan, that's why those are listed first too, because we want to get that done first. Good point. Any other questions come to mind?
Ms. Newman has her hand raised on.
Thank you very
the,
much.
chat
Ms.
box.
Newman. Ms. Newman, you're
I can, thank you, Mr. Chair. Yes, I can lower my hand. Mr. Manning made my point about ensuring that we ask full council for insight and recommendations. So I will lower my hand. Thank you, Mr. Chair, and thank you, Mr. Manning.
So again, like I said, Ms. Myers and I work on that and get some information out to you all regarding this process and group and so forth, and ask for additional feedback as we move forward. Any other observations, questions, suggestions right now, reference the development of this committee? If not, I think I have enough information for us to move forward, and we will do so. That brings us to item 4 on the agenda, Council COVID-19 guidance, recommendations, requirements for citizens, businesses in the unincorporated areas of Richland County. The question was whether or not we want to say to our citizens in Richland County, we know that there are CDC regulations, other regulations, and so forth, but the council wants to make a statement about what we would like to recommend and suggest to the citizens of Richland County. And that's why that was on the primary purpose of that being on the agenda. So let me just get some feedback reference that issue of concern. All right, this is mainly from some council members, committee members. So let me know what your thoughts are. Hello.
Didn't we not have a group looking into recommendations coming from small businesses already? Did not staff do some research on that?
Yeah. This is more deciding whether or not we want to say to businesses, please make sure you do social distancing, do certain things and so forth, whether or not we want to communicate anything to citizens and businesses in the unincorporated area about some kind of guidance and so forth from council.
Yeah. Oh, I think that we wanted to communicate, but in terms of what we were going to communicate would be based on our research using both the public health standards and business. And that was my understanding, that once that research was done, then we would review it and then make recommendations that what the council thought was appropriate, the appropriate message to provide to the businesses in unincorporated Richland County.
Okay.
Mr. Livingston, this is Delia Myers.
Ms. Myers, you recognize?
Am I okay?
Yeah.
I agree with Ms. McBride. I am concerned with timing. I think we're waiting quite a while. A lot of businesses are already reopening and do need some idea as to what the county recommends, if anything. I looked at the recommendations that came from the staff and did note that they didn't have any sort of public-facing inclusions, and that may be because the staff was waiting to hear from us. Most of it dealt with our employee core and our facilities, Richland County facilities. So I maybe would like to see, as Ms. McBride, some recommendations from the staff as to what we would as a body recommend for businesses in Richland County as good, practice to prevent the spread of this virus, which, as we all know, in Richland County and in the state has been ticking the wrong direction. So I agree that I'd like to see something, but I'd like to see us put some timelines around it and give the staff some clear guidance as to what we're expecting back.
Okay. And that would be business and public, correct?
Yes, sir.
Okay. So why don't we just task staff with that, and whatever kind of input we need to provide, we'll provide that, so staff can at least draft something, and the committee can provide guidance and then finalize something as soon as possible.
Mr. Chair, I thought that was already done.
Well, I think what Ms.
I
Myers
was,
is saying
I was
too-
waiting on I was actually waiting on the report, the recommendations based on research.
That was done with the focus, with the big focus on our staff and the public that's coming to our facilities and so forth. Not so much in terms of the public and businesses operating outside of the county.
Oh, I was under the assumption that we were looking at Richland County and we looking at the small businesses as well as staff. That's what I was under the assumption. So it was my mistake.
Mr. Chair.
Mr. Brown, would you like to respond to that?
Yes, sir. So in those conversations, the strategies that you see within the plan, the working draft, are consistent with the information. And I believe we have a few doctors on the call. I believe Dr. Osmond. I'm not sure if Dr. Sasser's on the call. I know we have University of South Carolina on the call. We may have also DHEC on the call. But all of those levels of guidance are consistent with when you are out in public to wear face coverings. Those are consistent guidelines, whether for employers or entities in the community. The same guidance also applies related to how you maintain your cleanliness. That guidance is consistent across internal and external agencies. And so is the social distancing. Those guidance are consistent across internal and external agencies. And so my understanding is that council may have wanted to, may have had some thoughts on some additional guidance specific to certain areas that maybe we have not routinely been addressed by the CDC or DHEC or any other officials, but those types of guidances are the same. I thought one of the conversations that were being trying to be addressed was whether or not the council or the county would strongly encourage, for example, when out in public to wear face masks, face coverings, face shields, whether there would be some type of a specific level of requirements versus general guidance or general nudging, if you will. So those are things that I thought were delineated between the information that I think I'm hearing described and what I thought was going to be coming from the policymaking level as to, face coverings, face shields, how you handle yourself out in the public space versus the privacy of your own home. So again, I know we have some professionals on the call, so I'll let them speak to some of those general guidance, because that's where our guidance is coming from. It's consistent with CDC, DHEC, as well as other guidance that we've gotten from our local providers. So that's my input right now, Mr. Chair.
Thank you. Yeah, I think the point was, I think there was a perception that the community and businesses need to hear something specific from county council. And I think, and an idea was for county council to submit and draft something and send out in terms of recommendations, requirements and so forth on behalf of council. I think it was, and that focus more.
Mr. Chair.
Yes. McBride?
Mr. Chair, I was thinking, well, again, I was under the assumption that we were looking at best practices. And even in terms of businesses, whether based on the space, you can have so many citizens within a restaurant, that these restaurants should mark the distance of 6 feet or however many that's adequate for that restaurant, that all people entering the restaurant, I'm just giving examples, based on back practices, the workers there need to wear masks, or the workers need to put up shields. I was looking for best practices based on our research to come back before us And then that we would look at those things and find those that were most practical and was in the best interest of Richland County. That's what I was.
Okay, I get your point there. And that could, and
that's what I think that's what's needed.
yeah, and that could easily be done. Since staff already been looking at some of those things and paying attention to that, we can easily ask staff to bring back those best practices, and then we can decide what we want to send out to our citizens and businesses.
Mr. Livingston?
Yes.
Yes, sir. Like Ms. McBride, I thought that was what was in the works. I would, if we're asking staff to bring back to us guidance for Richland County, which is the county and not just the Richland County owned facilities and employees, I would ask that we put some guidance around what areas we're looking at, because obviously we weren't clear enough last time, and a time frame around what we'd like them to do, and they may not be able to do everything within a time frame, but certainly we can at least have some goals set as to what we're looking for, because we're getting to a point now where businesses are opening back up, and you go places and you see people just walking around as if there's no pandemic. And I do think there's an urgency that maybe isn't tracking with our activity. Thank you.
Thank you. Well,
Mr. Chair, final
I'm
comment.
sorry. Yeah, go ahead, please.
I thought that was the purpose of us hiring a consultant, Tetra Tech, to help us develop these types of strategies. I'm a little disappointed in that it seems that each time that we're repeating and then having to come up with new things rather than a comprehensive plan. And that's what I assumed, that getting the consultants and working together, we would come up with a comprehensive plan. So I'm a little disappointed with at this point having to deal with this again.
Let's move forward and ask the administrator as soon as he can to come up with some best practice as it relates to information to the public and businesses regarding the pandemic in terms of recommendations and requirements from council.
Mr. Chairman, this is Jim
Yes, sir.
Manning.
Mr. Manning, you recognize?
Thank you. I've had my hand raised here a little while.
Thank you very much.
Thank you. So, one thing I'm a little concerned about in this conversation is that I've received in one of the multitude of packets for the council to review a potential sort of 6-week opening plan for the county. I just think that we need to be very, very guarded about putting out a plan for people in unincorporated Richland County and how they do business and the way they do business that A, would be ahead of us having our own plan, and B, anything that in the plan we put out for them would not be totally consistent with the plan for the county. So that's a caution that I have. Thank you, sir.
Thank you. Mr. Brown, you feel you have enough information to determine in terms of where we're trying to go on this item?
Mr. Chair, I believe I can look at the resource library that we have provided for the body and pull out those best practices from there and provide you with those best practices and those recommendations to follow those best practices. Yes, sir.
Thank you.
Mr. Chair.
Ms. Myers?
Can I just add to Mr. Brown, I hear what you're saying and I appreciate that, and I think that's dead on, but there are some best practices that would be applicable to people inside a building that might not apply, for example, to a public park. And since Richland County does operate those parks, I would expect that some of what we're doing is going to be in coordination with, the parks and the library and other agencies that are different from what we operate. And so it's not just, are we inside of Richland County buildings, taking people's temperatures and engaging in social or physical distancing and wearing mouth and nose coverings, but are there spaces that are different from the spaces that Richland County operates, where people also need a different kind of guidance. And I don't think that those nuances are reflected in the document that we've received. So I guess I'm asking to be sure that not only do you pull things out from the documents you've provided us, but maybe look at best practices for all of the spaces that would be impacted in unincorporated Richland County that would need to know what the county's best thinking is on these things. Thank you.
Thank you very much.
Yes, sir, Mr. Chair, and Madam Vice Chair. I think from what I'm hearing you saying, it would be part of our, in my mind, what would be our next maturation is that we would go and involve all of those other areas that are impacted by what Richland County Council might think, such as you mentioned the parks. And I'm still learning some things, but my understanding is, for example, that the parks are generally under the jurisdiction of the Recreation Commission, so that we would then partner with the Recreation Commission to determine whether or not what their plans were, so that we could understand from their perspective what they thought was in the best interest of the folks that they serve. I guess one of the questions I would have as we review those different types of examples is, could I get some consideration or some thoughts as to if in fact and I'll use the Recreation Commission as an example for parks, if they have guidance or best practices that they look at that may somehow be, for example, slightly different. So they may say, for example, and no one has said this, but what if they don't recommend or have any guidance on face coverings, for example, where Richland County as an organization does for outside agencies? Is that just something where we would see ourselves recommending that, and then kind of just saying this is Richland County's position on it? You know, how do we marry our thoughts and our guidance with those of those other agencies, which we may not have jurisdiction over, but we are impacting them and they're impacting us?
Mr. Chair, may I respond?
Go ahead. You go ahead first. Go ahead, Ms. Myers.
I'm sorry, I can wait till you're done.
Yeah, my concern is we'll look at those differences and so forth, and council will decide at least what they think ought to happen. We can't demand what some of the agencies do, but we can still say, you know, here's our perspective. Ms. Myers?
I would agree with that, and I would also point out that for those constituent agencies that are labeled Richland County, to the extent that if something goes wrong and there is, for example, no guidance or inconsistent guidance, and there are events that occur in those spaces, ultimately, when an entity is sued, it will be Richland County, and it will be the taxpayers who are then on the hook for that, notwithstanding that they report to a different board. So I would be careful with sort of the freedom that we're giving agencies, for example, to decide, well, you know, you're in a park and you may accidentally come within 6 feet of someone or 15 feet or however many feet is the guidance, but we can't control what you do in a public park. Well, my concern is that if there is no guidance, for example, as was the example, and I'm sure there wouldn't be an absence of guidance. I agree with you, Mr. Brown. But if there was no guidance and someone said that lack of guidance allowed space for folks to come in uncovered, right, and spread what they knew was a deadly virus, that there might actually be lawsuits that would find, you know, a space based on this. So I think it's important for us to look at all of the spaces that touch and concern folks within Richland County, those that we are responsible for and those that we are not responsible for, and put the best guidance out from the county standpoint, both morally and legally, in the middle of this pandemic, to make sure that we're doing the best that we can do to give guidance. So I would suggest that we are in coordination with those, but we remember that where the obligation lies at the end of the day as well. Thank you.
Thank you.
Mr. Chair.
Ms. McBride?
Yes, I would just like to support what Ms. Myers stated, and that we must remember these, that we would be providing guidance. And I guess that's the important word with this. Thank you.
Thank you. I think Mr. Brown is ready and understanding the charge there. For the sake of time, if there are no other questions, let me move on to item 5 regarding the county reopening and ask Mr. Brown to go ahead on with where they are with that. You may recall that was a substance of our previous meeting. Mr. Brown?
Yes, sir. So I definitely want to, as a part of this particular process, give some space for those who are joined us on this call. I know council had expressed on a couple of occasions the opportunity to engage members of our local environment who are officials in the public health space and in the medical space. I believe you heard Ms. Melissa Nolan, who has recently been introduced to the council, to the county, join the call. Dr. Osmond, who you've heard from before. There may be others on the call as well. But in a conversation, our most recent conversation with Dr. Osmond, who I will allow to give some insight here, as he reviewed our plan in its rough draft form, he thought that based on our plan that we would be somewhere in between phase 1 and phase 2 of the rough draft that we have provided for you. And so I know one of the questions that I had received was from the professional standpoint, what did they think about where Richland County stood within its plan in terms of its reopening? And so I just want to go ahead and answer that question for you, that Dr. Osmond reviewed it, and based on that review, he thought it was consistent with phase 1 or phase 2 of our reopening plan that you received in your council package and hopefully as a part of the committee. The other thing I wanted to point out, and then I'll stop and let Dr. Osmond and weigh in, is there is and has been for a while now a thought that was projected related to using data to determine when organizations may be ready to reopen on some levels. And as I listen to Dr. Osmond and others have this conversation, early on in the conversation about the peak of the virus and then the downfall of the virus, there was some initial thoughts of how things would go. And so the guidance that was given was, going forward, after you hit your peak and you think about reopening, you should consider looking at a trend of, so many days, I think it was 14 days, of downward, results of positive tests. And so since then, there has been some movement in terms of what focus an organization should utilize in terms of its metrics. And positivity rate has become a much more robust part of that conversation. And so before I pass it to Dr. Osmond, one of the things I would say to this committee, as you think about the guidance that you're going to provide for the community and your staff, that at this point, if in fact that we only utilize a 14-day downward trend as the data-driven metric that will determine when we can open back up, I'm concerned as the county administrator that may be a long time from now, because it does not seem that 14 days downward trend is going to be happening anytime soon. We're not on a downward trend in terms of positive cases by themselves. Looking at that flat number, you look at that flat number, you do not see a downward trend. And so I'm going to be asking for some consideration as to maybe other metrics coupled with that single number that we could utilize, but not just utilizing that as the only single driver, because if we do that, I'm afraid we won't be opening up for quite some time. So I'll stop there and I'll let Dr. Osmond.
Let me make sure. I think Ms. McBride, do you have a question before Dr. Osmond speaks?
Oh, no, I'm sorry. Let me lower my hand.
All right, thank you. I'm sorry. Go ahead on Ms. Brown.
Sure, and I'll let I hadn't had a chance to speak with Ms. Nolan as well, so she can certainly weigh in on that from her standpoint. But Dr. Osmond, I think it would be good if you could kind of help just give communication and information about looking at the solid positive numbers as the determinant versus or in conjunction with looking at something more like the positivity rate as an additional criteria to be utilized in conjunction with those numbers that we're getting reported now. So if you could go ahead and speak to that, and if Ms. Nolan, if you have some thoughts on that, if you could, Dr. Osmond, finish, and then you can weigh in.
Mr.
Sure,
Chair.
Mr.
Hold on.
Mr. Chair.
Ms. Myers, is that you? Yeah.
Yes, sir. Before the doctor weighs in, I'd like to layer over a question. with what Mr. Brown just said, because it seemed to me, and this is just my understanding, and if the doctors can tell me that I'm wrong, I'll be glad to hear that. It seemed to me that the change in that original CDC recommendation was political and not epidemiological. So I'd like some insight into that as we're weighing whether or not that should be how we make changes as well at Richland County. Thank you.
I agree.
Thank you. Thank you. Go ahead.
Mr. Brown, so before we talk about this, I just wanted to introduce you all to Dr. Scott Sasser, who is the lead physician for Prisma in the Midlands and is leading the response. And so I just wanted to give Scott a chance to say hello to the group and then sort of delve into that question.
So good afternoon, everybody. Thank you for letting me join the call. Thanks, Eric. And I just, excuse me, I know Eric and Dr. Dash and Dr. Nolan and others have been really engaged on this topic, but wanted to join the call briefly and just say we appreciate the opportunity to have the conversation, to contribute to the conversation, and partner with all of you as we move forward in the community and across the Midlands and the upstate. So I apologize, I'll have to jump off in a few minutes, but I'm going to stay on the line as long as I can, and we'll be happy to jump in as I can. Thank you.
Thanks, Scott. And so, Mr. Brown, I wanted to first say, and I know you've had some discussions, I think, with Dr. Nolan about this as well, but you know, early on in the pandemic, when the initial phased reopening plans came out, the prediction is that you would get a very sharp curve up and a sharp curve down, and you would eventually reach a point with very few cases in the community. But what we've really seen in May is that you had a sharp curve up and then cases came down, and we've been relatively flat for the last 4 weeks in South Carolina and Richland County included, and then with a slight uptrend over the last several days. Now, some of that uptrend in the number of cases is due to the fact that we are testing at a much greater rate than we were. That's very positive, that we're, you know, running a lot more tests throughout South Carolina and also the Midlands, and so we're picking up more cases. But there's probably also a uptrend in the number of cases, and that might be, you know, as we relax social distancing and some of the non-pharmaceutical interventions that were in place in March and April that were really keeping people apart, that the virus has now started to circulate a little bit more. And so I think we're really operating off of new and evolving information. And so while the phased requirements for reopening seemed very applicable in March, I don't think the data has gone in that specific direction to make that component useful. I think there are many parts of that document, the federal guidance on the phased reopening that can be used, but the gating is not turned out to reflect what has actually happened with the virus. And I'll let Dr. Nolan sort of jump into that as well and see if she's got any additional insights into that.
Dr. Nolan? Is Dr. Nolan still on the line?
She might be off. So you might only, Mr. Brown, you might only get my insight into that. But I do think it's important to, you know, look at some other gating criteria as well. Much to your points about, the reopening could be a long way off if we don't adjust the gating criteria appropriately. So some of the things that we're looking at, obviously inside the acute care health system, are the number of patients that we have in the hospital and the number of patients we have in the ICU and our capacity to care for additional patients. And our numbers have been relatively flat since the beginning of May, meaning, you know, in the whole Prisma system together, well, to give an example, for in the Midlands, we are usually ranging between 40 and 50 patients in the hospital each day that have COVID. That's not 40 and 50 new admissions. That's a total census of 40 to 50. And so we feel comfortable at that level that we can continue to provide care in the community for things that are non-COVID, and we can manage a reasonable number of new COVID patients coming in the door. The other thing that I think is helpful is to look at the positivity rates, meaning how many tests are positive compared to, or how many tests turn out positive compared to the total number of tests. And that number is controlled, for the number of tests that you do. And I think as we test more people, that number becomes more and more reliable. So looking at the positivity rate, and then in addition to that, targeting some of our testing into communities where we know there are potentially a few factors at work. One would be under testing. Two would be lack of, routine healthcare resources. And 3 areas where we know based on prior testing that there is a high positivity rate. And so that was a point of collaboration we discussed with Mr. Brown and his team. And Dr. Nolan was brought into that conversation from USC. And I do think that'll be a fruitful relationship moving forward. And so based on that, I thought that the steps taken in phase 1 and phase 2 from reopening that were presented in the draft plan were very good. And the challenge, as I said, was really with the gating criteria and where we were as far as the disease course. And that's why we're really maybe shifting the focus away from the absolute decline in the number of cases for a 2-week period, really to other things like positivity rate, healthcare capacity, and elements that are more objectively measured, such as those. And so over, and I will turn that over to you for questions.
Questions?
Mr. Chair, this is Dahlia Myers.
Ms. Myers, you recognize?
I have some questions that I might just refer to the administrator, given that I see we have 11 minutes left. So I would just ask first, what is the status of where we are as a county in terms of productivity, working the way that we are working now? What is, I guess, what you would consider as the administrator, what is your level of lost productivity or lost man hours as a result of sort of the emergency nature of the way that we got people out of all of the facilities, and maybe some of the lag in providing necessary equipment for them to effectively complete their day-to-day tasks. That's the first thing. Secondly, insofar as the gating criteria that you would recommend, you've clearly had conversations with the doctors and the team from USC. What is it that you're recommending as some sort of a hybrid reopening criteria rather than the 14-day limitation? Then the third would be, where are we in terms of standing up testing across Richland County? I don't know how others feel, but I am not going to feel comfortable giving you guys the green light on reopening any of the Richland County facilities with the testing in Richland County at its current status, which is why I keep saying we need to stand up some form of testing. And I know that there are going to be people who push back and say you can't test everybody. Well, there are counties across the United States who are doing a better job at testing, and I'd like to see us doing that so we know where we need to be quarantining people, and we know that there are different areas that people can get out. So where are we in terms of standing up testing? Do you need information from us? Do you need feedback from us? And then lastly, in the best of all possible worlds for you as Administrator, Mr. Brown, when would you like this reopening to take place? If you could wave a magic wand and have things go the way that you want them. And I know that would be yesterday, but I'm asking you to wave your magic wand in a COVID-19 world. Thank you, sir.
Thank you. Mr. Brown, Ms. McBride, I have a question.
Yeah, a comment.
Good.
Again, I'm agreeing with you, Ms. Myers. Today we are on target. But I have concerns about the testing because the testing is as good as the areas that you test in. And I'm concerned that some of the hot spots are not being tested. And how do we get to those communities that need to be tested? And so while I would consider some type of hybrid or in terms of determining when to open up the county, it is so important that we test and we test in the right areas so that we could get a true, more accurate response of the testing. And so until we're able to do that, I maintain I have major concerns.
Mr. Chair, may I give some information to Ms. McBride, Mr. Chair?
Yes, you may, Mr. Brown.
Okay, Councilmember McBride, you raised a very good point about testing, and so does Councilmember Myers. I have also had conversations with Dr. Osmond, and we have discussed the process for getting those testing sites requested. And we actually had a good conversation about that on this past Friday. So you will be hearing from me related to those areas. And we will be going through the process that we have in place locally, as well as trying to get some additional opportunities that we've discussed with our internal team with DHEC as well. So those questions are being answered, and we are in communication with not only Prisma, but DHEC, as well as some other resources to try to see about increased testing within Richland County in those targeted areas that have high numbers of reported COVID cases, as well as general testing all around. So,
Mr. Brown,
yeah.
Mr. Brown, what would be helpful for me is, if, and I don't know what it is, but if we can figure out what's required to come up with what I would consider a reasonable goal for testing, so we have something to shoot for, and we'll know where we're moving to and so forth. So whatever it takes to figure out what might be a realistic goal, let's try to figure that out.
And Mr. Chair, one other thing.
You recognize?
If we're going to test in communities, we have to find the means of getting that word out that there will be tests, because in several areas, I know that they have tested, but they didn't have the people coming out. One thing, they didn't know about the test. So there has to be a different type of messaging that we can reach out to get to the communities we need to reach. So that's going to be very important if we're going to get people to come out to be tested. And many people, we have to think beyond the drive-through testing, because many people don't have cars, and we have to take the test to the communities. Thank you.
Thank you. And let's continue on, but I know we're about to run into time for another committee meeting. Go ahead, Mr. Brown.
No, Mr. Chair, the last thing I would say is, and I took down some questions, but I will leave this thought with the committee, is in terms of when I, as the county administrator, would like to open, I want to open in an environment where employees feel as though that their best interests are being looked after. But I also want to be cognizant of what the policymaking body of Richland County, what their expectations are of when we will reopen. So I don't have a specific thought right now. I was just, I wanted to communicate to the committee specifically if in fact we were following the guidance that it would have to be a 14-day downward trend, that the way things are looking right now, I just wanted to make everybody aware that that information looks like it will be some time off. Certainly that could change, but that downward trend does not seem to be like it will be happening anytime soon based on the numbers as we've seen them. So I was just trying to inform the committee how that could delay any opening if in fact we were going to utilize that as a metric. So that's why I brought that up, so that you all would be aware of that. And I want to have some science behind that, so you will be aware of that also. But thank you very much.
Thank you. Ms. McBride, you still only recognized?
No, I'm good. Thank you.
And Mr. Brown, in response to what you just said, I'll just say based on what Dr. Osmond was saying, let's look at percentage of positive rate, and let's look at number of ICUs and some of those kind of things that he mentioned, and come up with what we think might be the best factors to use.
Yes, sir, Mr. Chair.
Mr. Chair,
Ms. Mike, you recognize?
Mr. Brown, I will follow up and restate those questions in writing for you so that you will have them in order to respond. But I think that they're critical from a path forward standpoint in terms of getting a vote to move past where we are now with Richland County. Thank you.
Thank you. Let me ask the committee whether we do have update reference the economic relief program that is also on our agenda later on. Are there any objections to waiting to get that at our regular council meeting?
Is it necessary to take action, Mr. Chair, in the regular council meeting, or is that just an update?
Let me ask the administrator whether or not he had any recommendations of anything in terms of action.
Based on the conversation at the last meeting, the council said that they expected that to take council action to approve awarding. So
the awards, yes. Mm-hmm.
I just have a number of questions, but
well, go ahead and ask your question.
In terms of, I don't know who made the decisions, who's reviewing the grant. I read the report, and then it was sort of confusing because it appears that they have a council, an advisory group reviewing the grants. And so in reading the report, I was sort of confused and did not know who was making these recommendations and what committee was that comprised of, who was comprised of that committee.
Mr. Brown, you're going to respond to that?
Good afternoon, members of the committee. This is Ashia Myers. I'll respond. Yes, that committee makeup was included in the documents when you all approved the grant in April of this year. The nonprofit, both of the committees are made up of employees to include members from our community grants, our community and government services department, the grants management department. Small business committee also has the representative from Tetra Tech on it as well. But that committee makeup was included in those documents when we first outlined the grant program itself and was ultimately approved by the council in April.
Mr. Chair, I read it differently because I thought that in a part of it as if Tetra Tech was reviewing it and making some decisions. So I was really confused about where the recommendations were coming from and about the whole committee process, in fact. Thank you.
Ms. Myers?
I know we're out of time, but I wanted to specifically note that, like Ms. McBride, I'm a little confused because I recall specifically saying that I agreed with the makeup of the committee, but that my recommendation was that there be some council representation on that vetting committee, and I don't see that.
Yeah, I do remember getting information about the committee and the makeup of the committee, but I don't remember whether or not I don't remember the requirement of getting the council member in there. I probably would have tried to follow up on that, but unfortunately, I just didn't recall that.
I recall it for information.
And again, that item will be before us at our regular council meeting tonight.
So it's going forward from the committee with no recommendation, is that correct?
Well, based on the comments, I'm not sure how we can have a recommendation, right? And so, right, Ms. Myers, that'll be from the committee with no recommendation. What I would suggest too. Any further discussion on that one? If not, I entertain a motion to adjourn.
So move, Mr. Chair.
Mr. moved, is there a second?
Second.
Second, is moving properly second. Ms. Robinson, please call the roll.
McBride,
Yes.
Livingston,
Yes.
Walker, Myers,
Yes.
Newton.
Yes.
It passes.
Thank you, meeting's adjourned.
Ms. Only.
Mr. Malinowski,
Yes, ma'am, Ms. Roberts.
you're looking for Miss Only?
Well, I saw her name up there momentarily. I don't have to have her. I was just looking saying, I guess we don't have, oh, here comes Shakise Newton now.
Yeah, I was about to say Miss Only's here.
I am here, I just can't.
Did you get my email?
We will see you then, sir.
No, Ms. Roberts, did you get my email?
I
The one I just said that said to have that committee start their meetings earlier or adjourn now and move on instead of cutting into our time.
I did see your.
Okay, thank you.
You're welcome.
Go on DoorDash.
Mr. Malinowski,
Yes, Ms. Newton?
I have had some trouble, but I am finally present for the most part.
We were gonna draft Allison if you didn't show up soon.
Please don't let me deny Allison that pleasure.
Okay. All right, well,
I have a lot of committees, so I'm just happy to be a guest.
and we're happy to have you. Thanks. Okay. I guess I'll now call the meeting to order for the Rules and Appointments Committee, June 2nd, 2020. Once again, for the record, as the last time, the meeting held prior to us ran over, and that is why we are not starting on time. Looking at the agenda, first item of business after call to order is approval of the minutes for May 19th, 2020.
So moved.
Okay, I've got a motion. I will second that. I don't see Miss Kennedy on here.
She's trying to connect, Chairman.
Okay, thank you, Ms. Roberts. Oh, we've got a motion and a second to approve the minutes. If there's no discussion, Ms. Roberts, if you'll call the vote, please.
Malinowski,
Yes.
Kennedy, I don't think she's here yet. Newton,
Yes.
it passes.
Next, item number 3, adoption of the agenda.
Mr. Chair,
Yes, ma'am.
I am under the impression that applicant under interviews 4B, Roger Leaks, has requested to be interviewed on a different date. So
That
with
is
that, with that, I move that we amend the agenda to remove item 4B and then adopt it.
Okay, I'll second that. So if there's no discussion, we have a motion and a second to adopt the agenda as amended, which was to eliminate item 4B, the interview of Roger Leaks, who's requested to be interviewed on another day. Ms. Roberts?
Malinowski,
Yes.
Kennedy, Newton,
No, Mr. Malinowski, I apologize. There was an item that we needed to discuss pertinent to the comment. So would it be more appropriate to discuss it under item 4B or to amend the agenda to add items for discussion 5F, which would be the comment board?
Actually, if we look at the minutes that were approved, Ms. Roberts, in the minutes, didn't we have something with the CMRTA last time? I'm taking a quick look here.
I will check as well.
Or was that the previous meeting?
It might have been the previous meeting.
It was the previous meeting.
Okay. With that, we could still eliminate the interview because that's all that was an interview. And go ahead and we can add the CMRTA, I would say as, let's just do it as 5F. And then after it's listed as 5F, it would be 5F, but included in your motion would be to take up 5F prior to the other items. How's that? That would
Works
be
for me.
okay.
Yeah.
All right. So Ms. Roberts, let's see, we did not finish the vote, did we, for approving the amended agenda?
We did not.
Okay, so now the amended agenda would be to remove item 4B1, the interview of Roger Leaks, and add item 5F, CMRTA board discussion, and 5F would be placed as the first item for discussion action prior to A, B, C, and D, and E. And that would be your motion, correct, Ms. Newton?
Correct. Thank you, Mr. Malinowski.
Okay, and I will second that amended agenda motion. Now, Ms. Roberts, the roll, please.
Malinowski,
Yes.
Kennedy, Newton,
Yes.
it passes.
Okay, items for action and/or discussion. Item 5F. Ms. Newton.
Mr. Chair, given that we have just changed the makeup of our appointments to the comment board since we last advertised, and that the organization is ongoing some strategic changes right now, I move that we hold future appointments of members to the comment board until we have additional information from the comment about the board profile that they need for the organization.
Okay, I will second that, but I would like to, we're going to need to send something out to the full council that this is what we need. No, I don't. I'm just wondering about that.
Well, you've seconded the motion. Do you want Ms. Roberts to call the roll for discussion?
No, we don't call the roll for discussion. We do discussion when we're done.
I'm sorry. That's true.
I'm just trying to think if we would, and we don't have anybody from legal here right now, if we need to take this to the full council and propose that prior to, and I would say we do, that we do.
Hey, this is Brad. I'm here.
Okay, Brad, thank you. We just changed the format or the makeup of the CMRTA through the full council vote, which added one additional council member and took away one private citizen from the board. So now for Richland County, the 3 members make up 2 council members and 1 citizen. So the question is, due to the change of the makeup of the board, how Richland County appoints people, we'd like to have input from the CMRTA as to what type of possible, I don't want to use the term requirements, but what would be preferred in a board member. And we'd like the council to, I think we need the council to approve that. We just can't hold up interviewing people and appointing them unless we ask the full council to come up with some type of board changes. Would that be correct?
I mean, I think that's the case. I mean, if you're talking about, a member who is appointed by the full council, then the criteria for that member and any input that you would want to be, shared with and, coordinated with the full body.
Okay, then I think properly what we should do is amend the full council agenda and advise them that after discussion in this committee, the committee recommends that the administration contact CMRTA to find out what would be preferred criteria for board members moving forward. Do you think that would work?
I think that'd be fine. Yes, sir.
Okay, then that would be your motion, Ms. Newton, or I can do it. I don't care. I'll make the motion that says that the committee makes a recommendation to the full council to have staff contact CMRTA in order to obtain what preferred criteria they would want in appointee to the board.
I'll second that.
Okay, any additional discussion? If not, Ms. Roberts.
Malinowski,
Yes.
Kennedy, Newton,
Yes.
it passes.
Okay, and you have that motion, correct, Ms. Roberts?
Yes, sir.
Okay, so then if you just give me that for tomorrow, just email it and then.
For today?
Oh yeah, for today. We're gonna do all that today. You're right. Thank you. Okay, now A. Well, hold on. Is Carol Hayward around? How do we get him in here?
I saw him.
Yes, sir. Mr. Hayward is on the call, Mr. Chair.
Oh, okay. Mr. Hayward, you there?
Are you muted?
Can y'all not hear me right
Nope,
now?
I can hear you now.
I see you there. Yeah.
I can hear
put
you
there.
now.
Yep. Okay, Mr. Hayward. Now that we've gotten all the administrative matters out of the way, you have made an application to be on the Historic Columbia Board of Trustees.
To be public because it's not known to the public.
And you do not serve on any other county board, committee, or commission.
I do not.
Okay. Question I have for you is you've got it says that you served as chair of Historic Columbia Palladium Society. Can you tell us what that is, please?
So basically it's kind of a younger arm of Historic Columbia. We don't actually advertise it that way, but it is it's a subgroup of Historic Columbia, if you will. On top of, the historic, trying to do the main stuff that Historic Columbia does as well. We also try to raise money for Historic Columbia. Some of the big events that we have and hopefully will have in the future after COVID-19 passes are things like bluegrass bidding and barbecue. And we've just started doing a fall tour. And last year's was a kind of a mid-century modern themed fall tour where we had people come and tour people's houses and properties as well.
Pardon me, I apologize for interrupting. Mr. Chair, right now we are live streaming this interview on YouTube. Typically, we don't record the interviews. So I just wanted to raise that point. I didn't know if we wanted to go into a breakout room to continue this discussion and then come back out, but that would conform more closely with our usual protocol.
You're right. We do not normally have public at the interviews. You're correct. I don't believe anything Mr. Hayward said he minds that anybody knows right now, though.
Probably not, but that's why I wanted to raise that point now.
That's a good point. Good point. How do we do that, Ms. Roberts?
Yes.
Mr. Chair, you would like the rest of the interview to be in a breakout room, yes?
Yeah, I think that's the way we should do it. And it would be any staff members that want to be there as they can be, any council members and Mr. Hayward.
Yes, sir, I can do that. Stand by, please.
You give us instructions as to what we all need to do.
Yes, sir. As you will receive something on your end, including Mr. Hayward, will prompt you to go into the breakout room.
Okay, thank you.
Ms. Roberts? Ms. Roberts?
Yes, ma'am.
This is Dahlia Myers. I just joined when they said that we were going off of the YouTube stream, so I'm here.
Oh, yes, ma'am.
We need music.
We need libations.
This isn't Jeopardy.
I'm providing my own in my mind.
Oh, okay.
It's pleasant.
Here it is.
All right, join and we're there, right?
Yes.
Good afternoon. Michelle? Miss Only? Just wanted to let y'all know we are back.
Session is what I'm gonna do.
Okay, I think we're all back.
Yes, sir.
All right. Actually, I did want to mention one other thing, but I guess I can't now. Well, I have a question. I don't have it in front of me, and Ms. Roberts, you may have it at your disposal there. The Historic Columbia Board, is it made up like some of our boards, like CMRTA? There are so many people from the county, so many from other municipalities. Do we have anything like that here because of the fact that Mr. Hayward is within the city?
Let me check the record really, Mr. Chair.
Okay.
Mr. Chair,
Yes.
while she looks for that, and either I missed it or I'm mistaken, often when we have interviews, we have an item on the agenda specifically to make nominations and referrals to full council. I don't see that here.
It's appointments, and it's not on here, and I'm not sure if it's on the full council agenda.
I do believe it is. But I'll look.
Yeah, look. It does have notification of appointments.
Mr. Chair,
Yes, ma'am.
I move that we add appointments to our agenda as item.
In order to do this, we got to go back and reconsider the agenda.
That is correct.
So make that motion.
Mr. Chair, I move that we reconsider the agenda.
I'll second that. Go ahead, Ms. Newton.
Mr. Chair, if we are in agreement to reconsider the agenda, I would move that we add item 6, appointments, to our agenda and make adjournment item 7.
I think I would rather do interviews and appointments under number 4. Just add the word and appointments, the words and appointments, and make it 4.
Works for me.
Make it 4C, notification of appointments. How's that?
So moved.
Okay, I'll second it. Any other discussion? Ms. Roberts, if you call the roll on that one.
Malinowski,
Yes.
Newton,
Yes.
Kennedy,
Yes.
Okay, so now we have that in there. And while Ms. Roberts is looking that up, as far as the specific rules for Historic Columbia, we can go on to item 5A, which is, I move that council work with staff to conduct a comprehensive review of council rules and recommend changes to streamline the rules to improve the functioning of council business. For your information, Ms. Newton, since we spoke earlier, I have gone through the agenda, all of the changes that people are requesting. I have them all placed in the very first section along with the staff changes, so we don't have to do any flipping back and forth. I can tell you where it is in the other ones if you'd like.
Okay, so for my information then, Mr. Chair, if I refer to the rules as presented on May 19th, is that going to be, what is your master copy that you're looking at for page numbers?
My page numbers start with 16, which was what we were provided as changes from staff/legal. And I go all the way through. Okay, so we could start in the beginning, go as far as we can through that. The only things I do not have would be yours. So
sure, my first change or question comes at item 1.3.
Okay, well, let's just start. I don't have any changes on page 16, 17. I start with page 18 under 1.1.2 procedure. After the words Robert's Rules of Order, I just think we should indicate dated and put a date in there. Then there can be no challenge to the fact we are following current Robert's rules.
Well, my question about that would be that, sorry, my alarm, is that it says the most recent edition of Robert's Rules of Order. Right. And so if we put a specific date, no matter what date we put ourselves in a position where we would have to change it every time.
I know that.
So,
but if you don't put a date, I'm thinking that we can get all kinds of questions. Okay, well, what are the most recent ones that you're following? And somebody's still going to have to look it up and provide the answer. But if it's here,
I agree.
Yeah, I mean, I don't know how frequently Robert's Rules of Order changes. So from my perspective, this is sufficient. But if you both want to put the date, then that's fine. We would just need a mechanism where we are, I think, reviewing the rules on a regular basis. I don't know the last time we updated them, to make sure that we update that.
Okay, Mr. Farrar.
But there is a new edition that's coming out.
Okay, Mr. Farrar, do you see that as a problem, adding a date in there for Robert's rules?
You can do that, certainly, and if it's not, well, I mean, it depends on if you're going to adopt them if you adopt them every January, kind of re-adopt them about the time you do the chair and the vice chair, which I don't know if that's something y'all would want to do, but if you adopted them every year, it wouldn't be an issue. The only thing that can come up is if you haven't changed them or adopted them in years, and then, it could be an issue, but I mean, certainly you can do it that way.
Okay, then I would ask that we include that one in there. And of course, when this goes to council, there's no telling what other additions, deletions will get recommended for. So
yeah, because
yeah, Ms.
Mr.
Kennedy.
Chairman, I'd like to say, because I'm going to do a little bit more thinking about that.
Okay. Well, for right now, Ms. Roberts, you there?
Yes, sir.
Can you, well, I see Ms. Only's name up there also, can either one or both of you on these comments we're making, make these changes for when this comes back the next time to the committee? Because I know we're not going to finish it today.
Yes, sir.
Okay, thank you. All right, you had 1.3, you said, Ms. Newton, correct?
Yes, I did. Thank you. In item 1.3, the text in red talks about unless its circumstances make it impractical or impossible to broadcast such a meeting. And I think Ms. Horatio had some comments along these lines. My question is...
Let me interrupt you that portion in red is from page 101, one of Ms. Horacio's requested changes. Go ahead.
On page 19?
On page 19, the portion in red came from page 101 of our agenda, which was Mrs. Horacio's first recommendation of 1.3 for open meetings. That red language is what she asked for.
Yes. Gotcha. Thank you. So from my perspective, would we consider cost as one of the things that made it impractical or impossible? Say, for example, in those circumstances where, say, we had a meeting at a new location because we were going to different spots in the district or having a retreat someplace else, and we were told it was going to cost $75,000 to broadcast our meeting, which I don't think would happen. My question is, do we need to specify cost, or can we just presume that it's implied? I'm fine to presume that it's implied. I just wanted to ask the opinion of the body.
I'm fine with putting it in there. Then there's no question that cost is something we're looking at when we do this.
Okay, so there's for example, in parentheses, if a meeting is held someplace other than council, excessive cost, or other difficulty.
That's it. Okay.
Thank you.
That's fine. We'll add excessive cost in there. Okay. Ms. Terratio, you also did have a comment on page 101 relating to this. Would you like to discuss that one?
Yes, meeting 1.3 open meetings.
Yes.
Okay. Yes. So, life has changed quite a bit since the last time we considered live streaming from a remote place other than council chambers. And so now we are set up with technology that we could Zoom from basically wherever we would be, presumably. Unless there was some kind of extenuating circumstance like a blackout or an internet outage or something like that. So I just wanted our language in the open meetings to reflect that we can and should transmit our meetings from wherever we might happen to be. And frankly, I think this gives us a little bit of opportunity to, have a council meeting in a different place in the county if needed. So I think that's wonderful. And including cost in the language, I think is fine with me. I don't really have any other additions or things to remove in this item.
Okay, so you're fine with what's been added in the red there?
Yes.
Okay. And the addition of the excessive cost.
Yes. Hopefully, though, we won't experience that because we currently have this platform to use.
Right. Ms. Kennedy, any comments on this?
No comments.
Okay. The only other thing I have for this is down there where it says the next paragraph, public notice of regularly scheduled meetings, special call meetings, and committee meetings. Mr. Farah, maybe you can tell us this. Do ad hoc committees, would they come under that, those two words of committee meetings?
They would. It's basically all inclusive. We could add ad hoc, but then you might have to also put, like blue ribbon and all that other kind of stuff in there. So
well, that's
I think with I think with small C committee, it covers every category of it.
Okay, that sounds good. Moving along, where will your next one be, Miss Newton? And then I'll go from there.
My next item is page 20 regarding special called meetings. I think Mr. Manning also made a similar suggestion. So.
Right. Okay. Hold on then to that because we're not going there yet.
Mr. Malinowski?
Yeah, I'm coming. We've got Ms. Terratio on page 101 for 1.4 executive session.
Okay.
Her comments are also in there, and I believe they start with letter B of that redlined on the bottom. Is that correct? Go ahead, Ms. Terratio.
Well, in 1.4, there's only there's all the strike through, and then there's just the one paragraph that begins with in accordance with the South Carolina Freedom of Information Act, et cetera.
Right.
Sorry.
No, you're right. Go ahead.
Okay. Then it says the chair presiding officer shall announce the specific purpose of the executive session. My comment was, could the purpose of the executive session be published in the agenda? Maybe that's a comment for the agenda section. I don't know. so that the public could see that we're going into executive session for a personnel matter, receive advice from legal counsel, et cetera, so that the public would know the nature of the executive session.
Mr. Farrar, would you care to comment on that, please?
Well, yeah, you certainly can put, the type of, purpose of the executive session in there. My only caution on that would be is you need to make that not limit yourself. In other words, if you list something like, hey, we want to talk about a personnel issue, and then right during the middle of the meeting, some major legal issue arises, and you say, well, doggone it, we didn't advertise that, so now we can't hold an executive session. I mean, the executive session under the FOIA, you can take one of those anytime you want to, at any point during the meeting, whether you've even advertised it or not. I mean, basically, that's something comes up that's so significant that you may need to talk about it right there behind closed doors. And, so that's what I'm saying. If you're going to list the purposes, I don't discourage you from doing that. I think sometimes we even do that. We'll put like a litigation item or something, but I would just put a little, maybe a catch-all, like, and I think we do this at the retreats where it's a little asterisk that says, public body may go into executive session for any reason provided for under the FOIA, and that kind of covers that.
Okay, well, what about this? What if we added the reason for the planned executive session items, and then if another one arose, it could be stated out loud. But if we know in advance when the agenda is published, I believe that we should disclose it at that time if it is a planned executive session item.
Yeah, no, I think that's the way to do it, because, you've got the things that, you don't know what you don't know. So the things that don't come up until the meeting, you're not going to have that awareness anyway. So you can always reserve the right to go in there. But yeah, if you know about in advance, like, hey, we're going to talk about a DOR update, and we know that, 2 weeks ahead of time, you can put that in there, and certainly can do it that way.
I would advocate for that. Thank you.
And I think, Mr. Farrar, could we, at the point of the executive session, indicate that the executive session items listed may not be the only ones that would be placed on the agenda pending what happens at the meeting?
Well, you talking about state that on the agenda?
Yeah, because if we're listing the ones that we are going into executive session for, somebody's going to say, well, you didn't have that one listed on the meeting.
Yeah, I mean, I think it's, and how this would be phrased, I'd have to give it some thought, but I think, known executive session items at the time the agenda's printed are listed, and, any additional matters can be taken up as provided for under the FOIA, and were that to come up, because I don't think we have too often the going into executive session about something that's not on the agenda in some form or fashion. So if we were to have that, it'd probably be a good idea for either the chair or the lawyer just to kind of comment at that time, we're now going to go into executive session on this matter that's come up during the course of the meeting per the FOIA.
Okay, but other than that, we could place on there the ones that we know at the time the agenda is being made up and what it is for.
Yes, sir. Yeah, you could do that. I mean, that would need to, we need to be diligent with that as we get to the agenda deadline, because sometimes we get a kind of a placeholder type thing, and we need to firm that up by the Friday deadline. But yeah, you could do that.
Okay, so Mr. Horacio, that's what you'd like to see there. I'm fine with that.
That is what I would like to see. Thank you.
Okay, so
Mr. Chair,
yes,
I'm completely fine with us taking that action, and I think it's an appropriate action. My question, whether it's for the body or for our attorney, is that something that belongs here under executive session or something that belongs under agenda?
Mr. Farrar.
I'm not sure I understand that. So when we have the item, say like attorneys for matters, the attorney for executive session, we would typically list, although sometimes they're in a different portion of the agenda. Like I think, in fact, tonight, I think there's a personnel item listed under the administrator, so that we would highlight that and say that would be an item that would be appropriate for executive session. But I'm not sure I understand what
Ms. Newton is referring to in the rules. Where would it go?
Oh, okay, in the rules.
Item 1.7 is listed as agenda.
Yeah, I would put it under the agenda part. And let's see, 1.7, where is it? Yeah, probably 1.7, what is that, subsection C5? First county attorney report of executive session, and then we could just put that item there, like, items listed on, because you think about this, if it's not on the agenda, you're gonna have to add that to the agenda at the meeting, or it's gonna come up. So basically, agenda items listed will state the, purpose, and it's probably gonna be generalized, like receipt of legal advice or economic development, or whatever the reason is.
Right, so Mr. Farrer, could you just create the sentence or two that's needed and provide that to the, one of the clerks?
Yeah.
They can put it in there.
Yeah, 1.7 C5, yeah, we'll put that in there.
Okay, my other question on this 1.4 is at the very end, the last line that's in there where it says no action may be taken in executive session except to adjourn. I didn't realize we could adjourn a meeting in executive session. I understand we return to public session is the action, but why would we adjourn during executive session?
Yeah, that's basically straight out of Roberts. And I guess that may be misleading because you come out and you make a motion because I guess the action is to basically come out of the room and return to public session. I don't know if that's necessarily taking a vote or those are basically the two things that you can talk about in executive session. I mean, you can't, take a poll back there on anything else, but the two kind of procedural things, you need to come out or you can leave the meeting. So, but you would have to have a motion to adjourn the meeting. I don't know, that's straight out of Roberts, so I'm not exactly sure the rationale for it.
Could maybe that be looked into a little more with either
Sure.
additional explanation or just eliminate it? Because the way I'm looking at
Yep.
it, okay, we adjourn that back there and we all come out and walk out the door and go home.
I got you.
That's all, that's my concern. Okay.
Yep.
thank you.
Okay.
So you look at
Okay.
that.
Yep.
Next thing I have is 1.5. We have several comments here. You know what? I'm just wondering, I'd like to ask the members of the committee, Ms. Kennedy and Ms. Newton, that based on this agenda, there's a couple items that are on the actual full council agenda. And I'm thinking we should discuss those so we can make a recommendation if we're going to do it or hold it in committee. Because as you can see, in 20 or 30 minutes, we haven't gotten very far with these rules. And it's going to be a while more. So if there would be no objection, I think that we should move to the items that are on the full council agenda. And that one was, I don't even see it here. Let's go to the full council agenda.
I officially have too much paperwork.
It's not in ours here, but it's the one on page 5 of the full council agenda that says, it's from Mr. Manning. In my continued decade-long battle for accountability, transparency, efficiency, and effectiveness, I move all county council standing committees and ad hoc committees and one-time short-term committee meetings be held in council chambers as the Transportation Ad Hoc Committee with votes recorded in like fashion. Ms. Roberts, am I missing that here in our agenda? Or is it not here? I don't see it.
Mr. Malinowski,
Yes.
this item has already been taken up and was decided to move forward to full council, which is why it's on the full council agenda.
Right, but there's no page number by it on the full council agenda that says what action was taken or what the committee recommends, which we're going to need that.
You were sent something on last week, Mr. Malinowski?
Yeah, I saw it.
By Miss Only, did you?
I did see it, but it's not here in the full council agenda, and I guarantee you, nobody's going to know what that decision was. Well, I can go back and look before we get to the full council meeting and just read that then, if that's fine with everyone.
It's fine with me. My recollection was that we were not recommending this item for approval based on potential conflicts with the meeting room, simultaneous meeting times, et cetera.
That's correct. So I'll go back and get, was it Miss Only that sent it to me, Kim?
Yes, sir.
Okay, I'll go back and get the wording she sent, and I'll just make that recommendation when we get to the council meeting. The other item that we do need to discuss is notification of appointments. We have for Historic Columbia, Mr. C. Carroll Hayward that was interviewed. Ms. Roberts, did you find anything at all in the rules for Historic Columbia referring to what the board makeup is?
The only information that I found says that county council will designate 2 representatives, and that is all that it states.
Okay. Ms. Kennedy, I don't know if you were here at that time or when I said it, but my concern was that, as we've discussed before, Mr. Hayward is not in the unincorporated area of Richland County and will have decision-making over the activities and the finances of Historic Columbia. But then the other way of looking at it is our chair, Mr. Livingston, likes to say is that, well, they still reside within the county, they pay taxes, and they, you know, we've advertised this, and this is the only person that's made the application. So do you exclude them for that reason or not? Any discussion on that?
Mr. Chair.
Yes, Ms. Newton.
So I'm not aware of how the seats are appointed for Historic Columbia. I do know that I am very familiar with the Palladium Society and its work and how fully integrated it is with Historic Columbia. And so regardless, given not only that he's the only person that applied, but given it's 2026 years of dedicated involvement to promote Historic Columbia and their mission and extending their reach throughout the county, which is what the Palladium Society does, I would move that we appoint him to the board. Once we got to that point and Ms. Kennedy had a chance to provide feedback.
Well, we're there. We have a motion to appoint Mr. Hayward to the Historic Columbia Board. Is there a second? I'll second it for discussion purposes. His 20 to 26 years, maybe within, I mean, from a young person up, he's been with the society since 2014. So 6 years he's been with them. He did seem to be knowledgeable about everything. Ms. Kennedy, your thoughts?
Mr. Chair, I am not quite sure if Ms. Kennedy is still on the line. She did give me a call to let me know that she may have to leave. I'm not getting a response from her, so she may not be on the line.
Okay, thank you. Well, then we've got a motion and a second to appoint Mr. C. Carroll Hayward to Historic Columbia. Ms. Roberts, if you'll call the vote, please.
Malinowski,
Yes.
Kennedy, Newton,
Yes.
it passes.
Okay, surprised you, didn't I, Miss Newton? Okay, so we've taken care of 2 things that are on the council agenda. The other one, and I don't mean to push the rules off, but I can see this taking several meetings to get through it. But the other one was the item that will affect the county when it comes to procurement. And that's Mr. Walker's motion regarding to not give contracts, the county not give contracts to individuals or companies that are in litigation with the county. Now, I don't know if everybody got the particular information that was sent by Mr. Farah. in response to that motion. But the one main point was Mr. Farrow recommended to keep focus on performance rather than on status. And I agree with him after reading it. And he has a suggested language that we could use to accomplish what Mr. Walker and I myself would like to see done. Now, if,
Mr. Chair,
yes,
I apologize. I didn't mean to interrupt. I know we are now encroaching on the Economic Development Committee
Okay.
meeting's time. I have read the information that was provided by legal and would support this motion with the addition of that language that was suggested.
okay, Ms. Roberts, if you don't have that, I can get it back to you, but it's at the very last paragraph of Brad's email where he says his suggestion would be to add language such as the following to subsection such and such of procurement codes. So if you're making that a motion to support that language, Ms. Newton, I will second that.
I do. I move that we support the motion with the addition of the qualifications provided by legal.
Okay, and any additional discussion? If not, Ms. Roberts, if you could make sure this is one with that language that gets on the next full council agenda based on the vote. So if you'll call the vote, please now.
Yes, sir. Mr. Chair, if you would send that information to me, I would appreciate it.
I will do that.
Malinowski,
Yes.
Kennedy, Newton,
Yes.
it passes.
Okay, so that'll be on the next full council agenda as our recommendation. I'll get that to you, Ms. Roberts. And since we are at the deadline, go ahead. Move to. I'll
Mr.
move
Chair,
to
move to
adjourn.
adjourn.
Okay, second. All in favor, Ms. Roberts?
Ms. Malinowski,
Yes.
Kennedy, Newton,
Yes.
it passes.
Okay, we're adjourned. Thank you, everyone, for attending.
Thank you.